Today I'm going to talk to you a little bit about pelvic girdle pain. Unfortunately, it is a reality for many of our pregnant patients and as well as our postpartum patients. But what many people don't know is that there is something that we can do about it. As pelvic health physiotherapists, we are well versed in assessing and treating those with pelvic girdle pain, and we can help to make your pregnancy and that postpartum period much more comfortable. So today I'm going to show you a very easy test that we do here in the clinic and something that you can do at home as well, called the active straight leg raise. What this test tests for is whether or not we have good dynamic stability around the pelvis, meaning are our inner core muscles working well for us, as well as our low back and our pelvic floor muscles to stabilize the pelvis and make it easy for us to lift our legs. So today I'll show you how the test is done, and you can try this at home. And then we'll talk a little bit about what we can do after if you find that there is some discomfort with this test. So it's as easy as lying on your back with the legs out straight in front of you. And what we try to do is lift one leg. And what we're looking for is how easy it is to lift that leg. And then we assess the other leg as well, just lifting up, just so it's a couple of inches up off the bed. What we're looking for with this test is if there's any tension or torsion happening through the pelvis, or if patients feel any pain or discomfort as they lift one leg. Sometimes people will experience as well one leg being a little bit heavier than the other, and what that tells us is that maybe we're not getting optimal stabilization around the pelvis with those pelvic floor muscles or those inner core muscles. So as pelvic physiotherapists, we can help to address this by looking for any asymmetries in muscle tension or tightness that may be contributing to this difficulty with lifting one leg or the other, as well as teaching you some very simple core exercises. Now, if you're experiencing pelvic girdle pain, another tool that we have in our toolbox is the Sacroiliac joint belt. Now, there's lots of belts out there on the market, so it's a good idea to talk to your healthcare professional, particularly your physiotherapist, about what belt is right for you. So the belts that we use here in the clinic look something like this. And the idea is that the belt is used to help create compression around the pelvis, kind of acting similar to that of our deep core muscles. These belts are often used particularly later in pregnancy when we're having a harder time engaging those tummy muscles as the belly gets bigger. So where the belt sits is somewhere between the top of the hips and where the hip bone is at the bottom. The belt will wrap around like this. And quite often there's some gentle stays at the back that help to give a little bit more compression as we pull across and wrap around. Now this can obviously sit underneath clothing. Usually we recommend that it sits on top of the pants and beneath the shirt, but it helps to create a little bit of gentle compression around the pelvis that can be really helpful with making us feel nice and stable, particularly if our jobs or our everyday functions require us to be standing on our feet for prolonged periods of time. So if you're experiencing pelvic girdle pain, or you think that an SI joint belt might be appropriate for you, please feel free to come in and talk with one of our therapists here.